Hello, good afternoon, everyone. We move on to the research question. You have been told the finer points about how to prepare the dissertation, the overview. And now we go by one in the different sections. The first section is the research question on hypothesis. We start, I'll put it on slide so. So what is the research question? Research question is actually the problem you are trying to address by your research. So this is the points we'll be discussing. These are the learning objectives. How do you make a good research question? In fact, they say that asking the correct question is solving 50% of the problem. So a good research question. And how you generate a hypothesis. Actually, there are two types of research question. One are straightforward, like you want to find the prevalence of a particular condition in a population. So the other type is when you are comparing two groups. Once you compare two groups, the hypothesis testing comes into play. And we'll just briefly go about the nitty-gritty of hypothesis testing and what can be the types of errors which can come in hypothesis testing. Actually, this you will be told subsequently in more detail, but when you are making the research question, you have to think through. Thinking through makes you contemplate these problems which can come later. So if you have not thought out through the subsequent phases, your research question or your research hypothesis is not very strong. And what are the biases? Again, as I said, these are the for subsequent sessions. But while framing the research question, you have to keep that in mind. Types of bias. And after you write the research question, how to write the aim and objectives. And what is the difference between aim and the objectives? So this is how we'll proceed. So what is the quality of a good research question? Before quality of a good research question, how do you get the research question? The scholarship is first, you should have a good review of literature. What do you see in the review of literature? This has to be, as Professor Tilak said, your introduction should have a very brief overview of review of literature. And that review of literature should build on the research question. There are 4 themes in the review of literature. What is the clinical or public health problem? You have to review that first. When you write your introduction, give few recent references about establishing it as a clinical problem or a public health problem. Second, review of literature. Second thing to see in the review of literature is the studies already done on the same research question you are contemplating. What are the studies which are done? Very brief synthesis, just 1 paragraph. Third is what have been the limitations on the studies or controversies on the study. That is how, while you are reviewing the literature, you have to see that. And last 4th paragraph is what your present study is adding to the literature or extending the literature or replicating the literature. So these 4 themes should come in the review of literature, which will make you build up the research question. Then clinical experience, that is from your day-to-day clinical experience, you are seeing cases, you may get an idea of a research question. Teaching experience, of course, you are new, but you must have some teaching experience to discussion with students or interns may give you an idea of a research question. Anecdotal, you see some cases or hear about some cases that can raise a year. Then pattern in data. Suppose you are just tabulating data or you are seeing some pattern in data. That can give you, I'll just give you a very brief example of this pattern. And intuition. Intuition is something, I don't know how to define intuition, but some people have defined intuition as intelligence breaking the speed limit. You can't define it, but you get some insight, some gut feeling, that is intuition. So after you get the research question in your mind, you have to see whether it is practical or not, whether it would be feasible or not, whether you will be able to do it or not. For that, there is a mnemonic for all research questions, that is FINER, FINER, FINER. F is for feasible. You have thought of a research question, but you have to see whether you will get adequate patients, resources, adequate time, adequate money, and whether you will be able to implement it. That is called feasibility. Second is interesting. The research question should be interesting to you. Otherwise, research can be quite tedious. So if it doesn't interest you, you will have difficulty in pulling it through. Novelty. Novelty is, as I said in the review of literature, novelty means in what way your study is extending over earlier studies. In what way you are adding new to the literature. To establish the novelty, you have to have a good review of literature. Ethical. There is a session on ethics. Whatever research you are trying to implement, it should be ethical. Ethics means autonomy. You should not encroach on autonomy. It should beneficence. There should be benefit to the society or to the participants. There should be no harm, non-maleficence. And there should be equity. There should be no exploitation of vulnerable people. So these are the 4 principles of ethics. You will have a separate session. That is autonomy. There should be informed consent. There should be beneficence. There should be non-maleficence. And there should be equity or justice. No exploitation of the vulnerable. This is for all research. And there is another, what is this called? Mnemonic. There is another mnemonic for any intervention or clinical trial. If you are planning some intervention trial, some you want to give a new drug or a new procedure, those are called intervention studies. For that, the mnemonic is for clinical trials, mnemonic is PICOT, P-I-C-O-T. P is you have to define, you have to think in the research question, who will be the participants? Describe the participants subsequently in your material and methods. As I said, when you think of the research question, you have to think through into the next section also. Who will be the participants? I. What would be the intervention? New drug or new procedure or new surgery? You have to describe that in details. Intervention. C is the control group. What type of control group? You have to describe the control group. O is the outcome. How you are going to measure the outcome? Very important. Outcome measure. T is the time. What will be the duration of study? So this is outcome, how measured, and time. Please mute your. Please mute at your end. There is a lot of disturbance. Please mute. As I said,
Do you find like if the test happens in your lab?
There are a lot of disturbance. Please mute at your end. So there is, as I said, the research question can be the uncertainty, which can be straightforward. You want to find out a prevalence, or it can be a research hypothesis. That's drug A is better than drug B, or one variable affecting the other variable. So that is a hypothesis. When you are trying to compare 2 groups, or when you are trying to predict something and you are trying to measure an outcome. So this becomes a hypothesis testing, that there is a particular outcome and there is something which predicts that outcome. So these are tested by observations, good. And this hypothesis testing in empirical research is not, you cannot prove it, but you can disprove it. So we try to first state a hypothesis and then state that hypothesis is null hypothesis. That is, there is no difference in the 2 groups, and we try to collect the evidence. Whatever data we collect the data to dispel the null hypothesis. And if this null hypothesis is dispelled, by default, we accept the hypothesis. So this is important, that we cannot directly prove a hypothesis, but we can state it in the null and then disprove it. And then if we can disprove it, null hypothesis of no difference, then by default, we accept that yes, there is an association between this predictor and this outcome. Then types of hypothesis, null hypothesis. As I said, the primary hypothesis is say vitamin D prevents against severe COVID. I am just giving you one example. So null hypothesis will be there will be no association between vitamin D and severe COVID. So that is the null hypothesis. Then alternative hypothesis is that if you can reject the null hypothesis, you accept the alternative hypothesis, that is vitamin D prevents severe COVID. I am just giving example that my hypothesis is ki from anecdotal and from some literature review, I have heard that vitamin D prevents, it raises the immunity and it prevents severe COVID. So my hypothesis is vitamin D is preventing severe COVID. But when I start the study, I have to say that there is no association between vitamin D and severe COVID. And then I can take a group of patients who have got normal vitamin D level, and the control group is people who have low vitamin D level. And then I see the outcome in the severity of COVID. So if I find that this there is a significant difference in vitamin D levels in the two outcomes, and which is I can reject the null hypothesis and accept that by default that vitamin D prevents severe COVID. But I have not directly proved that. I have just indirectly rejected the null hypothesis when I have collected adequate data to dispel the null hypothesis. Then one tail hypothesis and two tail hypothesis. That is, one tail means I am very sure that vitamin D will prevent severe COVID, but it may be that too much of vitamin D may cause severe COVID. So either vitamin D may be beneficial or it may be harmful. So this is called two tail hypothesis. One tail means I am sure of one direction. So usually we take two tail because we cannot know in advance. We cannot presume in advance whether an intervention will be beneficial or harmful. Many interventions are harmful also. So that is by default, whenever you, because all this you will require when you are calculating the sample size. Sample size may you require the type 1. I will come to that. What is the hypothesis? What is your study question? How much difference in the level would be clinically relevant? So one tail hypothesis, you are very sure of the direction. Usually we don't take one tail because sample, of course, advantage one tail means sample size becomes less, but that is not fair. You have to take a two tail hypothesis because in advance you do not know whether it is superior or inferior, any intervention. So I am just trying to familiarize you with the terms. It will be repeated later. So I am just giving an example. As I said, hypothesis can be generated by seeing the pattern also. This is a data from the about 7-8 months old data, or even I think last year data. There are certain 3 tables. Different red countries are the Western countries, Asian countries are in green, and African countries are in blue. What we are comparing is we have just tabulated the median age of the countries, the first column. Second column is the overweight percentage. How much percentage of the people are overweight by BMI. And the third is the death per million from COVID. Death per million from COVID. So can you form any hypothesis? Anyone? Do you see any pattern in this? One pattern is that the Western countries are having the higher death per million in 4 digits. Asian countries are having 2 to 3 digits. And similarly, African countries are also having the lesser 3 digits or 2 digits. The Western countries have got a higher level. What other thing I see in the Western countries, that they have got a mean age. This is mostly around 40, median age. They are older population compared to the Asian, which are usually in the 20s, and African median age is 20. However, one distinct here is that overweight percentage is almost 60% in the Western countries and around 20% in the Asian countries and around mostly 20% in the African countries. And my hypothesis is, I can generate a hypothesis. I'm just giving for example purposes that overweight is related to death from COVID. This is my hypothesis. Overweight is related to here. And my hypothesis, I am more confident of this hypothesis when I see some outliers.
There might be interruption.
So my hypothesis becomes stronger when I see certain outliers, like Brazil is a lower age, 30, but it is overweight, almost 60, and its death is also in 4 digits like the Western countries. And Japan is another outlier, which has got a higher age even in the Western countries. 47 is the age, median age, but its obesity is 27, and it has got a much lower fatality from COVID. Similarly, when I see the African countries, most of the age are in the 20 median age, but there are 2 countries which are obese. That is, Egypt is 63% overweight, and South Africa is 54% compared to other 2 African countries. And their mortality, fatality in Africa is higher in 3 digits, whether other. So this is just a hypothesis. This data does not prove anything. This data only gives you a substrate for hypothesis. It only triggers a hypothesis. So my hypothesis from this is that overweight is a predictor of fatality from COVID. So this is an example I am giving of such patterns. So you have to eyeball the data. This data is at the population level. This is called ecological data. So this is just one example I am saying how you form an hypothesis. And subsequently, I will see how we proceed further with this research question. My research question is whether obesity is related to fatality from COVID-19. So this becomes my research question. So when I null hypothesis kya hoga? Null hypothesis hoga ki there is no relation between obesity, overweight and fatality from COVID. That is by null hypothesis. Now, when I start my study, I would start with that there is no association with that. And I try to gather the data to knock down the null hypothesis. If I am able to knock down the null hypothesis beyond statistical significance, then I will accept, yes, alternative hypothesis is there is a association between overweight and lethality from COVID. So in hypothesis testing, there are 2 types of errors. This is also important. This is also important because these things will be required when you are calculating the sample size. Type 1 or alpha error and type 2 or beta error. Type 1 error is that there is actually no difference. That is, there is no association between overweight and lethality. But in my study, in my sample, I found a difference. That is known as type 1 error. Type 2 error is there is a difference. Actually, there is an association between obesity and lethality, but in my study, I have failed to find a difference. This is called type 2 error. Type 1 error is when there are no difference in the 2 groups, but I find a difference. And type 2 error is, or beta, when there is a difference which I fail to find in my sample. Type 1 error is usually kept at 5%. That is why P is equal to 0.05. That is, you are keeping the type 1 error at 5%, 1 in 20. That means that if there is no difference between the 2 groups, if 20 people repeat the study, one will find just by chance. That is, the difference will be observed even if there is no difference in 2 groups, 5% times it will be observed by chance. And type 2 error is usually kept at 20%, 0.20. That means with this given sample size, 20% times I will miss a difference even if there is one. So usually we are more liberal with type 2 error, and type 1 error we are more stringent because we want to establish a new association. We have to be very sure about it. So type 1 error, that is your P is equal to 0.05. This I have just mentioned because this will be required for your sample size calculation, as you will see later. So this is just to summing up how to compare, understand hypothesis testing is just like a court of law, because court of law is also dependent on empirical. That is your evidence. We are also evidence. We have data, they have got witness. So when a person is given a charge sheet, that person is given a charge sheet that he has committed murder, but when he comes to court or she comes to court, the judge assumes innocence. Similarly, when we form a hypothesis, but once we start testing it, we start with the null hypothesis of no association. Judge starts in the court of law is innocent till proved guilty. So guilt did come. So a person may be guilty, might have committed crime, and alternative hypothesis is that there is an association. Criteria for rejecting innocence is beyond reasonable doubt. they have the witnesses and they have adequate number of witness or evidence, then only reasonable doubt. We have got a p-value, that is the alpha error, less than 0.05, we reject the null hypothesis. Correct judgment is convict a criminal. If a person has committed a crime, and correct experiment is correctly conclude an association when it is present. So similarly, we can make a mistake in the court of law also. There can be two types of mistake. One type of mistake is acute an innocent person. Innocent person. Similarly, in an experiment, we can correctly conclude no association. No association, we correctly conclude. Then similarly, in court of law, we can have a wrong judgment, hanging the innocent person or punishing an innocent person. Similarly, in experiment also, we can commit an alpha error, incorrectly find association. That is alpha error. So hanging the innocent is alpha error in the court of law, and incorrect association, finding association is alpha error in your research study. Then incorrect judgment can also be acquitting a criminal. Person has lack of evidence, a criminal goes scot-free. Similarly, in our study also, in research also, we can fail to find a difference when there is one. So this is just to put things in perspective that neither research is very clean, neither court of law is very clean. There are a lot of imperfections. In research, it is quite messy. And similarly, court of law is also very messy. So this is empirical studies are not very, cannot prove anything. We are indirectly trying to establish associations. So these are imperfect science and imperfect law. So next time we should not blame the judiciary. कानून अंधा कानून है, हमारा रिसर्च भी अंधा होता है. And this COVID has brought it out कि कितना अंधा चल रहा है, रोज कुछ नया आ रहा है. So we should be humble for other professions also. We should be humble for our own professions also. So these are, as I said, type 1, type 2 errors should be stated in advance. Of course, this Dr. Jadhav will cover in detail when sample size calculation. And 1 minus type 2 error is the power of study. 20% times you miss, 80% times you will find it. That shows how with this, if you want to increase the power of the study, you have to increase the sample size. And besides this type 1, type 2 error, how much difference you are trying to detect, which would be clinically significant. Just 3-4 milligram of difference will not make any clinical value. So you have to put that as a clinical judgment. इतना difference, जितना ज़्यादा difference आप दोनों group में detect करोगे, उतना आपका sample size कम हो जाता है. That is called the effect size. So when you are making a research question and you carry it forward, there are 3 types of bias which you have to consider in the planning stage only. One is the selection bias. Your sample is not representative. Selection bias. Suppose you take only people who are from upper socioeconomic stat, and vitamin D may be just one factor. There may be other factors which may be protecting them. So you may get a wrong impression. That is selection bias if your sample is not representative. Measurement bias. Your measurements are not proper. Reagents are not proper. Your trainers, your people are not well trained to collect the measurements. This is called measurement bias. Or your questionnaire is not bringing out the things which you want to measure. Most of the studies in psychological scales or other things not validate. That can give rise to measurement bias. And the most difficult is the confounding bias. There may be other factors, like you are doing the study of vitamin D and lethality from COVID. There may be other factors besides vitamin D which have an impact on the lethality. So those become the confounding factors. So when you are doing research, you have to think and make a way for measuring these 3 things, whether there is selection bias, whether there are measurement bias, and most importantly, what can be the other regions, that is the confounding bias. So now I have given the study question from this pattern that I want to see the association of vitamin D and lethality from COVID. So my aim is the research question. So aim I will write, aim is to study whether obesity is a risk factor for fatal outcome from COVID-19. This is my aim. What is the difference between aims and objectives? Aim is the overall goalpost. My goalpost is to see whether vitamin D predicts the fatality. Objectives are how you reach the goal post. You have a football, you have a different players who take the ball to the goal. So objectives are the steps by which I would reach that goal. So you have to think through. So how do I write it? Objectives. which would be feasible, which could be doable, is measure BMI of sample of patients admitted with COVID-19. Suppose I am starting a prospective study. All those who come with COVID diagnosis, I measure the BMI. That is my first objective. Then identify other factors which may contribute to fatal outcome COVID-19. We know now that diabetes can also, socioeconomic status, your hypertension, comorbidities, that can be the other factors, the diet, nutrition, other things. So because this will help later in controlling for these confounding factors. If you do not measure in advance in your objectives, you cannot salvage, and you may not know whether the association is due to obesity and COVID-19 outcome. I may even measure vitamin D also, because I am saying that vitamin D also has been reported. It may be that a non-obese person may have very low vitamin D and is fatality may be due to that. So there may be, you see how complex it is. There may be some known confounders, there may be some unknown confounders. So I could think I have to do a lot of review of literature to see what are the other factors which have a bearing on lethality from COVID. All those also I will measure, because I am taking a primary predictor as obesity and outcome as here, and I will measure all other things to see when I want to adjust later multivariate and see whether these, or I may have to control for these confounders and find a clean association between obesity and fatality. Then follow up this patient with recovery, death, discharge, or loss to follow up. This is my third. And study statistical significant association of any between BMI and fatal outcome after controlling for confounders. I will take the mean BMI of those who have survived, mean BMI those who succumb, and then find whether there is any statistical difference in the mean BMI. Different tests are there, it will be, and then I will also try to control for confounders. So this is how I have just given an illustrative example. According to your own research question, you will have your own aim and objective. I hope it is clear now. I think this is a live slide because my topic was up to aim objective. Thank you. And any questions, you are most welcome to ask now. Most welcome to ask later also.